Talk to me about the furlough scheme. We've had the extension announcement. It's going to cost something like 300 billion, apparently, that according to the papers this morning. How are we going to pay for it? It has to be an increase in taxes, surely, at the very least.
I don't think we recognise those figures. I did see a story in the newspaper, but right now we're still within. We're right in the middle of this thing, aren't we? So I don't think it's right to be able to come up with an end figure at this point. No one could know. It is, of course, true that had we have not done this, then we'd end up with a much bigger bill because all of those people and millions of people, in fact, would be unemployed right now. So that very sensible scheme, the furlough scheme that the Chancellor's further extended yesterday, it will now go through to October with some changes from July. That I think is very important. Look, in terms of payment, we'll have to have future budgets and get to that. But right now we are still in the midst of this thing, and we're clear that we're not going to go back to sort of a world of austerity in order to do that. We've only got
a limited time, as I always say to government ministers in the morning, so let's canter through as best we can. Furlough fraud. We've done an expose here on Sky. Hundreds of employers have been taking government cash while pressuring their staff to carry on working. What advice would you give to those workers? Do they ring the hotline and say, this is what I'm being forced to do?
Well, that's absolutely right. I mean, I think most employers and indeed most employees have responded admirably. But of course, in any scheme, around the edges, there may be people trying to abuse it, and that would be a criminal offence. So employees will do the right thing, I'm sure, when that type of thing happens. You can't be claiming government money whilst, of course, not furloughing staff and making them work. That would be completely against the rules of the scheme, and HMRC would have something to say about that.
So people need to whistleblow, yeah?
Well, absolutely. I mean, people can't break the law on this. This is a very generous scheme, and it's designed to make sure that the economy can continue. But you're either furloughed or you're not. Although later in this scheme, as the Chancellor outlined yesterday, you may make some changes to that. Right now, it is completely black and white. People cannot work if they are furloughed.
COVID commuting. The unions are warning of potential lethal consequences and chaos on public transport as we're heading back to work today. Are we going to provide transport workers with PPE?
So generally speaking, Public Health England say that's not appropriate outside of the sort of clinical settings. We have asked commuters, where possible, to wear a cloth covering, so a face covering, which is out of cloth. And there's very clear instructions, actually, if you go on gov.uk on two different ways to make those. And that's because the 2 metre rule still exists, social distancing on public transport, but where that's not possible because people are passing each other, that sort of thing, then that can provide a bit of reassurance to people. So we're asking people to be very sensible and not flood back to public transport. That's the big key message. Even with all the trains and buses back to running when they are, there will not be enough space. Only 1 in 10 people would be able to travel without that overcrowding.
How are you getting in?
Well, I'm not. I'm actually at home.
You do the news conferences, don't you? So how do you get in then?
Yeah. So in which case, take a car, and we're saying to people, take a bike, and I announced a £2 billion programme. £2 billion for walking and cycling at that press conference, the last one you're talking about, or drive. And those are the options. I'm also bringing forward trials of e-scooters, hopefully to next month. So there's some further options for people to get around. But it's very important that we enable enough space on public transport for the sort of key workers, people who have no other option, because clearly sometimes there won't be another option. And then it's very important that people don't overcrowd that system, which will be extremely restricted for the time being. And I saw in your report a moment ago mentioning of some police and transport workers outside of stations. That is to sort of try to remind people these are not normal times. This is not going. Sure. This is small steps. It's not business as usual yet.
But are you the Transport Secretary who doesn't feel safe on public transport?
It's not a question of not feeling safe, but we know that 2 metre distancing is something which is the best protection against getting the virus. I'm afraid it doesn't disapply just because we're on public transport. There's a little bit of reassurance that can be provided by those face coverings, but nonetheless, we do not want to see crushes on transport. We're asking people who've been brilliant, and the public's been fantastic in terms of observing the stay at home. Everyone has followed the rules, and nearly everybody's following the rules. And we're asking people to make alternative transport arrangements that ideally work from home. That's still the key message, unless your job means that you have to leave the house.
Yeah, 8,000 jobs could go at Chewy. That is the holiday company, of course, flights, etc. We're going to be on the beach in Spain in the 9 o'clock area on the programme this morning. A lot of our viewers will not be because of this 14-day quarantine rule. Too little, too late. Why on earth are you doing it now?
On the quarantine, which is saying that when people come to this country, they will need to stay in one place for 14 days. Since the wider message to everybody is continue to stay at home unless you need to travel, it would be crazy to then to have free flow of people who could then travel around. The question about why now, I may have mentioned this to you before. Right at the beginning of this, I asked the chief medical officer for advice on this, and he was very clear that whilst the disease is prevalent in the UK, there's no point sort of shutting the borders, as it were, and countries who tried have ended up with very high death rates, the USA included. Now, though, as we see the numbers drop, or not yet, but we hope soon, it becomes worthwhile doing not to be re-importing it. And so entirely based on medical advice.